Okay. Okay, we want to welcome today Peg Enslen. Peg serves as the Health Science State Leader at the Delaware Department of Education, and her background is nursing. And we were so pleased when she was willing to suggest a best practice for work-based learning in her state. And she encouraged Debbie Kirk to submit a proposal to do this webinar today. So we'll have Peg introduce Debbie, but I had the pleasure of meeting Debbie on Monday when we did sort of a walkthrough practice and found out that her background is agricultural education. And so I told her that we loved ag and we loved ag teachers because we think that they health science and ag science represent CTE in such a positive way. So no, we don't care if she's a former FFA advisor. We welcome her to the stage today. So with that, Peg's title is work-based learning specialist. I'm sorry, that Debbie's title is work-based learning specialist, but I think Peg's going to share a little bit about her and then turn it over to Debbie.
Yes. Thank you, Nancy. And Deb, what you don't know is that my oldest son is a chicken farmer. So we're all in good company here. So hi, everyone. Thanks for being here today. So as Nancy mentioned, I'm Peg Enslen. I'm the health sciences lead for the first state. And we are a small state, yet have many fine examples of successful health science programs and work-based learning programs. Debbie is from the Appoquinimink school district. Say that 3 times real fast, right? So we call that Appo for short. They just expanded to a 3rd high school, and they're doing a phenomenal job of providing opportunities for all students, and especially our health science students. So thank you for your participation in today's webinar. I'd like to turn it over to Debbie Kirk, who is Appo's work-based learning specialist, as Nancy mentioned. So she'll be presenting their work-based learning program. And Debbie, thank you today for your hard work in preparing this presentation and for presenting it today. I hope that you all enjoy this and learn something from it, and we'll be available to answer any questions at the very end.
And Debbie, before you get started, I did want to say that she has some forms and some content that she's definitely willing to share. So after the webinar, she'll get a copy of the chat. So if there's something that you see you want, you're welcome to put your email there in the chat and what it is that you might want to request from her. And we'll see that she gets that and is able to share that with you. Okay, go Debbie.
Thank you, Debbie.
Well, thank you so much for that amazing introduction. And it is such an honor and a pleasure to be here. I feel like I don't have to introduce myself now, since that was such a lovely introduction, but I am an ag teacher at heart, and this is my 4th year as the work-based learning specialist in the Appoquinimink School District. I have learned a lot about the healthcare pathways in the past few years. I've really connected with our health science teachers, and we're dear friends, and they do an amazing job here in our district. So it's such an honor to be able to support them and their students with work-based learning. So as Nancy and Peg shared, I'm going to just kind of tell you a little bit about what we're doing in Appoquinimink, and I am happy to share anything that we're doing. So if you see or hear anything today and you have questions or you would like additional information, please feel free to reach out. I've included my email as well as Peg's on the final slide that you'll see, and we're very available. So if I cruise over something or you'd like to know more, please reach out, and we're happy to answer questions and share anything that we have. So just to give you a little bit of background about our district, we launched work-based learning in 2018. And we started with the establishment of a strategic plan. We have a vision statement that you can see here for our strategic plan. So we're in year 4 of launching work-based learning. And as the work-based learning specialist, I support all of our pathway areas, not only health science, but health science, our allied health pathway was one of the first 3 that we launched work-based learning in our district. So year 1, we started with 3 pathways that we really focused on. And then year 2, we expanded to 7, and we have a development cycle. By the year 2024 is when we should be offering, and actually in our district requiring, work-based learning across all pathways. So we've been really involved with our healthcare pathways from the beginning because they were one of the original 3 that we started with. So we always say that work-based learning is the intersection of students and industry partners. And when students ask, what do you do, Ms. Kirk? I always say it's my job to put students and industry partners in the same space. And that may be physically, it may be virtually, it may be through email, it may be through a Zoom call, it may be through a field trip. Anytime I can put students and industry partners in the same space, that's the goal of our program. And so we know that through work-based learning, students benefit through experiences and certifications and networking opportunities. And of course, workforce readiness training that I'm going to share a little bit with you today, our approach regarding workforce readiness training. But we also know that it should be a mutually beneficial experience, that our industry partners should benefit from connecting with our students as well. So we work very closely with our industry partners. We work to provide them a pipeline of future employees. We take feedback from them regarding instructional materials, suggestions, support. We give them the opportunity to connect with our students as future employees. And we know that a lot of our industry partners, they partner with us out of community service. They're just giving back to the community. And so we have an amazing network of partners, and we've worked really hard to build that network. One of the main ways that we have been able to do that and do that to the scale that we have is through advisory boards. And so in our district, we have advisory boards for our pathway areas. And the approach is a flipped model approach. So it's not unusual to have an advisory board or an advisory council, especially for the CTE pathways. But in our district, we have a flipped model approach where we have a healthcare advisory board, but they're independent of the district. And they actually organize as a nonprofit organization. They have an officer team, and they plan regularly scheduled meetings, and we participate in that advisory board, not as the leadership, but as partners and participants with them. Currently on our advisory board for the Appoquinimink district, we have a variety of different specialty areas that are represented. So on our board, we have a director of rehabilitative services for one of our hospitals, an owner from a local physical therapy organization. We have representation from human resources with a rehabilitation center, and we also have someone that works in office management for one of our local doctor offices. So we have a variety of different specialty areas that are represented on that board. They help us so much with work-based learning placement. So I'll explain to you in just a few minutes how we kind of gather the areas of interest for the students. But once we've identified the areas where students are seeking to be connected, one of our first steps is to reach out to the advisory board and to say, can you help us connect with industry partners in these areas? And they really assist with doing outreach on behalf of our district and connecting us and speaking out on behalf of our work-based learning program. They also, as we meet periodically throughout the year, they support with curriculum needs, they support with certification support, and in some cases, they assist with fundraising support. So we are very fortunate to have the advisory board that work as partners with us. You can see here, we have periodically throughout the year, we may host a partnership breakfast where we invite new partners to come and just learn about our programs. And our advisory board members are really instrumental in helping us facilitate those opportunities and kind of are just an extension of our program where they speak on behalf and make connections for our students. I did want to share with you, I did ask one of our advisory board members what he would want to share. And so he did provide this quote, and I won't read it to you. I know you can see that on the screen, and you'll see that when you refer back to this later. but we are really fortunate to have amazing business partners. And it is through their partnership that we've been able to grow work-based learning in the Appoquinimink district. Our work-based learning continuum begins really in 6th grade. And this is a graphic that I know is a little bit difficult to see on the screen. We do have a PDF that I'm happy to provide for you. We provide this in partnership folders that we distribute throughout our community when we're sharing information about work-based learning with someone that may be willing to partner with us to host students. We always share the continuum. And we talk to them about different ways that they can connect with students. So immersion is obviously one in which we're asking the partner to host our student for an extended period of time. But we also look for many opportunities to bring our partners in, whether it be a guest speaking opportunity or a lunch and learn. We look for opportunities to send our students out for worksite tours and job shadows. And then, of course, we have partners that come into the building to assist with things like enterprise. We have some in-school enterprises and some industry mentored projects. So we have a lot of visitors that come into the building for various experiences across the continuum. And of course, we enjoy sending our students out as well. Part of our district initiative is to continue offering these experiences and continuing to support not only middle school, but starting to partner with our elementary schools as well, just to make sure that we're introducing students to career opportunities and industry partners as early as we can. This graphic just kind of sums up for our partners what our program looks like. And so you'll see that we offer workforce readiness curriculum, and that's a requirement for all of our students. And we then say that before a student goes out for a work-based learning immersion experience, we know that happens their senior year. Our goal is that students have no less than a minimum of 10 experiences from the career awareness and career exploration buckets, if you will. So we are looking for students throughout their high school career to experience at least 10 opportunities to have a guest speaker, to go on a tour, to experience a job shadow, to participate in work-based learning experiences that are going to connect them and prepare them for the immersion. So when we're partnering with industry representatives, we share with them that throughout high school, not only are the students having experiences across the continuum, but we're also preparing them with the workforce readiness that they need. And so once the student reaches the senior year, we feel confident that between their work-based learning experiences and their work readiness curriculum training that they've had, they're prepared for that immersion.
Debbie, before you leave that slide,
Sure.
you talked about workforce readiness curriculum. Is that something that you developed within your district, or what do you use for that?
It's actually our next slide. So.
Okay. And then the other question, this immersion, was that a word that you all came up with or borrowed?
Well, when you look at work-based learning terminology, that's a pretty common term for that final experience, I guess you'd call it. So most of the work-based learning research that we did in building our program defined the work-based learning continuum along the lines of awareness, exploration, and immersion. And we have a Delaware Office of Work-Based Learning, and that's consistent with the terminology that they use as well.
And is that office within the Department of Education?
That is actually, and Peg, I'll defer to you. And I know they're connected with Delaware Technical and Community College, so I'll let you speak to the connection with DOE.
Right. So we work in conjunction with the Office of Work-Based Learning. So there is a partnership between our one community college system and that Office of Work-Based Learning in continuing to develop. Now, they've always been in existence and have done work with the college students, but we're now extending that to also include out the high school students as well. So they're partners.
Okay, thank you.
Absolutely. And they support us at the school level, they have employer engagement specialists with the Delaware Office of Work-Based Learning that help support us in terms of outreach and network and connecting us with opportunities across the continuum for students. So you did ask about our workforce readiness curriculum, and that is something that was developed locally, but it was developed by advisory board members. So I mentioned our healthcare advisory board. We have multiple advisory boards, and the advisory board for our Academy of Finance specifically worked on a workforce readiness curriculum that we then adopted across the district. So what you see here on the screen is a photo of the book. We actually have a physical copy of the book, so we can hand students a physical curriculum book. And then it contains 4 sections in the book. Students receive training in resume, interviewing, networking, and workforce tips. And then this curriculum book is also housed in our Schoology system. So Schoology is what we use for the platform. I'm sure it's many of you are familiar with Schoology across the country, but that's the platform that we use for student communication. And so that is where we can house our workforce readiness curriculum. We have it digitally, we have it in the book form, and our workforce readiness curriculum actually received an award through a Delaware organization. And so the team that helped build that curriculum is featured there. This curriculum is actually under revision already. So it was developed in 2018 when we started to use this. And we already know that the curriculum needs to include virtual information. So there's an interviewing section, but we now know that virtual interviewing is becoming much more prevalent and that our students are experiencing that. We also know that Zoom etiquette or any kind of interface like this where the students are virtual for interactions, we know that we need to include etiquette in their workforce readiness. And we recently, in one of the revision meetings, brought in a representative from our community, from our social work department here in the district to provide community services and community support that our students may benefit from. So we may include in the revised version of the curriculum information about transportation, public transportation, how to access public transportation and how to utilize that, and other community resources that may be beneficial. So our workforce readiness curriculum has been amazing and already under review. So by the spring of this year, we hope to actually have a 2022 version of this ready to launch.
Is that Debbie, there were a couple of questions in the chat about a copy of that. Is that something that is a purchase, or how do you distribute that?
So it is not something that we have made available for sale, so to speak. At this time, there was, it's owned by the advisory board. And so it's utilized internally right now. I think that it is something that we could, if there was an interest in the curriculum, we could take that back to the advisory board and share that with them because they are the developers of that. So I would be happy to pass that along and provide additional information about that.
And the answer was yes, please.
Yes, great. If you would share that in the chat, I will be glad to take the chat information and then follow up with details.
And if you're putting things in the chat, remember to include your email in case you're asking for something. There was a question from Michelle about, are soft skills included in that training?
Yes, absolutely. And so there's the booklet and there's the Schoology module. But what we do is we actually require our students to participate in a workforce readiness fair, and that's where we present the curriculum. So we don't leave it to them independent of the support of industry partners. And obviously what they have in Schoology is a little more independent, but that's what we use to wrap back around for students that maybe miss our workforce readiness fair, or they join our district, after the workforce readiness fair has occurred, or there's a lot of different reasons we may have to help a student to circle back around to that. But we actually have a workforce readiness fair, And again, we have a development cycle. So the first year we only had a few pathways. And then in 2019, we actually had an in-person workforce readiness fair in partnership with Wilmington University. That's one of our local university campuses. We took students from 7 of our pathways to Wilmington University. We had 378 students that we took. We take them their 11th grade year. So the juniors from those 7 identified pathways traveled to Wilmington University, and we had over 50 different industry partners that joined us on the campus, and the students actually rotated through a series of workshops on resume development, interviewing skills, networking, and workforce tips. And we had, as you can see, almost like a career fair kind of room where the students could walk around and practice networking. And what you see there is a panel of industry professionals that shared information about general workforce tips. And they might talk about social media use, or they might talk about general workforce etiquette. It's kind of that, here's the things that you need to know before you come into the workplace that don't really fit neatly into those other sections of the book. And so we present that through a panel discussion. And we ask questions about things that our industry partners have seen in the workplace, or things they wish they had known when they were in high school. So that workforce readiness fair is a requirement. And we say that students must demonstrate proficiency in workforce readiness before they go out for an immersion experience. In 2019, we had the opportunity to go in person. Last year, we were actually kind of in and out of school, as I think a lot of folks were, but we were committed to workforce readiness training nonetheless. So what we did last year in the spring, our 2019 was a December event. And so it was the school year prior. Last school year, we did not hold our event until May of 2021. We partnered with Junior Achievement in Delaware, and we offered a virtual workforce readiness fair. And what that looked like was a series of Zoom workshops, again, presented by industry professionals. So we had representatives from our advisory board and from our community, from our network, that were healthcare professionals presenting workshops to our healthcare students on resume development and interviewing and networking. We have 25 different pathways in the Appoquinimink School District, so we know there's a lot of variation in what students in different pathways may need to hear about resume development, interviewing, and networking. So we try to have that information presented to them by the professionals from that industry. With our partnership with Junior Achievement, they had a virtual career fair platform. So our students actually did live Zoom sessions in the morning by pathway. We covered all of our curriculum areas presented by industry partners of our district. And then in the afternoon, we held a series of industry chats that students could join. And we also offered that virtual career fair platform with Junior Achievement. So that was a requirement for every 11th grade student in our district. That's over 800 students. And then for students that for whatever reason could not participate that day, we have the Schoology modules, and we actually have videos from the day of. So they're actually seeing and hearing from the same professionals that presented to our students on the day of the event. This year, our goal for 2022 is all juniors, every 11th grader in our district across pathways. And our goal is an in-person experience, but we don't have details yet about what that's going to look like. We do have a curriculum, and we do know that we will have something. We're ironing out the details of that. But it has been a tremendous opportunity for us to connect our industry partners with our students. And it's been, again, mutually beneficial. One of the things that I will mention, and you'll see it later in my slides because I feel pretty strongly about it, is engaging our alumni. And so we're making it a goal to really follow up with our students and to bring our alumni in so that they're making that local connection. And on this on the panel that we have the Workforce Readiness Fair, we're intentional about inviting back our young adults, those that have graduated within the past few years that can come back and share some of their experiences in the workplace. So our immersion experience happens during the senior year. And so we do have Delaware work-based learning standards, and we require the students to satisfy those standards. And they include everything from they include everything from
73.
from workforce
Okay, that's what I
readiness.
wrote down. So you want to redo that?
If someone's not muted, let me see if we can figure out who you are. Okay, maybe they got their stuff under control. Okay.
There we go. So there are Delaware work-based learning standards that we have a crosswalk of our local requirements with the work-based learning standards to make sure that students are prepared with everything leading up to their senior year. And then we do require our students to have a training agreement, a confidentiality form, and a permission to participate form. So for our students in allied health and public and community health, these are the documents that we require before a student goes into a placement experience. These are all forms that I have that I can certainly share with you if you were interested. Let's see here. For an immersion experience, we define those as an internship, a practicum, a service learning experience, or it could be a student-run enterprise. We don't necessarily see that in our healthcare students. The placements for allied health and public and community health tend to fall in the internship or practicum category, occasionally a service learning. But I will share with you in this photo, this local veterinarian who actually hosts internships for our students in healthcare as well as our animal science pathway. She's a graduate of our district. So she's an alumni. She went to veterinary school. She has opened her own veterinary practice and now supports our students with placements, as well as, you know, other work-based learning experiences. So we are very fortunate, and we are working really hard to make those connections with our alumni. This is a copy of our work-based learning training agreement. I know it's hard to see. I wouldn't expect you to be able to see the details of that. The reason I share it is so that you can see that it's a fillable PDF. So when we're getting ready to place a student out on an immersion experience, we have them complete a fillable PDF that we then send out through Adobe Sign for electronic signatures. And that has really helped us just in terms of managing our documentation. We can send it out for e-signature. Once everyone has signed, all of the signers receive an electronic copy of the completed document. So it's really kind of helped us just in terms of, we don't shuffle papers around. When I think about the way it used to be and collecting papers and signatures, and you get them back and they're all bent up and coffee spilled on them, and sometimes the dog ate it, and there's a whole variety of reasons why the paper, and then that paper has to be, you know, housed somewhere. So we have Google folders, and these go out for e-signature. They come back completely signed as a PDF. We drop it in the Google folder, and everything is archived in our Google Drive. Our permission form and our confidentiality form are also fillable PDFs that we send out for e-signature. So we're working very hard to get away from anything paper that has to be exchanged. Not that this has been flawless. There's been some room for error, but we've definitely improved, and we're finding it to be pretty effective. Oh, and I should mention, we have an on-site training agreement, and we also have a virtual training agreement. So the language is very similar. Where the variation is when it talks about the student responsibility or the student agrees to in the virtual training agreement really addresses the student's interaction on camera, that if you're with an industry partner and an experience, your camera is on, you're participating, and really just kind of reinforcing that virtual etiquette that we mentioned. One of the things that occurred in our district that I think has been really impactful, our district has historically had a requirement for a senior project. So that's not new. Students for many, many years have been required to do a senior project. Last fall, we actually took that historic senior project and it evolved to a capstone project. So again, this is across all pathways. It's not specific to allied health. What it meant is that our capstone project required of all seniors, every pathway must include a 50-hour experience involving an industry partner. And so what we've said is that that capstone experience and the work-based learning kind of go hand in hand. And as the work-based learning specialist, I work closely with our capstone facilitator to make these connections and support the students in these activities. And this has really helped us, just in terms of scaling across the school and across the district. We do have advisory classes. They meet every other week. When students are placed in an advisory schedule, they're placed by pathway. And the senior level advisory class is typically the pathway lead is typically the teacher for that senior level advisory class. So it just gives them an opportunity to reinforce and support with capstone and work-based learning. Now, the tricky part with allied health and public and community health is that our pathways are so large. We only have 2 teachers and we have 5 different advisory sections. So in that case, it is a little bit tricky. We do have to provide additional support. But students are required to maintain a capstone portfolio. We do that through Google. That just started, but the goal is that students will establish that portfolio their freshman year. It will follow them all 4 years, and they will continually put information there that they will then graduate with a portfolio that is full of their credentials and just important materials that they can take with them. We surveyed our students. This is just a screenshot of the survey that we supplied. So our students participate in the Workforce Readiness Fair in the spring of their junior year. And we follow that up with this capstone and work-based learning placement survey, where before we ever leave school, what we're asking the student is, what is your availability? What are your areas of interest? And we utilize Google Forms for that. It gives us a spreadsheet of our students. We can sort by pathway. We can sort by areas of interest, and we can then go into the summer knowing we have between both high schools in our district right now that have, Peg mentioned we have a 3rd high school, but this is only the 2nd year for that school. They're only up to grade 10. So we have juniors and seniors at 2 of our 3 high schools. That between those 2 schools, we have over 170 seniors right now in the healthcare pathways. So a lot of students that we had to connect with partners. So by doing this at the end of their junior year, we were able to really identify some key areas like pediatrics or imaging or whatever their kind of common areas of interest were. And over the summer, we could really work on helping to build that network so we had enough placement opportunities for our students. We have on-site, hybrid, and virtual experiences. And I think we all know that the virtual came about because we had to. But we were able to do that and figure it in such a way that it was very impactful. And I've got a video here where you'll hear from some of our students that did virtual experiences. The common theme across these is that students must do 50 hours. They must document 50 hours and they must have an industry partner. So if they're on site, they're spending 50 hours and they've got an industry partner that's working with them as a mentor. If they're virtual, they're documenting 50 hours and that's on their entire experience, including research and presentation and kind of that overlay of the capstone and work-based learning. But we've said they must document a minimum of 6 touch points with their mentor. So virtually, it can't be all email. They must document touch points and we can facilitate that through Zoom or Teams or whatever. Sometimes the mentor just takes the lead and sets those up. Sometimes we support with that. Sometimes it happens during advisory class. Sometimes it happens, I kid you not, I was invited to join a group last year that was meeting at 7 o'clock on a Friday night. And I wouldn't have believed it if I didn't see it, but I went to the meeting and they were really there and it was in healthcare and the students chose that time and the mentor set it up and there they were. So it can really, it's very flexible. We have a rule of 3. If students are going to be on Zoom, there have to be at least 3 people on the call. And so we say that can be 2 students and a mentor. It can be 5 students and a mentor. It can be 2 mentors and a student. Whatever. We just have at least 3 people on that call. So it's never one-on-one. And the student must document no fewer than 6 touch points with their mentor throughout the duration of the experience. Hybrid, and I guess I can move ahead here. Hybrid is a combination thereof. So I'm just going to give you some examples of some of our on-site experiences. These are all places where we either currently have or have had students on site. And surprisingly enough, some of these were last year, even in the pandemic time, even when we weren't necessarily in school, we did still have opportunities for our students to go to some of these locations and go in person. And so I won't read all of these. I can certainly, for the sake of time, I don't want to go through each of these individually, but I would be happy to give you details about what these look like and how they facilitated those. We know that our on-site experiences are limited to what they would normally be, because there are places that we work with as partners that have said we can't have extra bodies in our space right now. And so we know that you know, this list for on-site experiences will expand as things change. But these are all examples of places that last year and or this year have hosted students on site. And I mentioned 50 hours. We tell students it's a 50-hour experience. Some students complete that in several weeks. Some students, it takes several months. It's completely up to the student and their situation and their availability and that of the mentor. So it's very flexible to their schedule. It can happen during the school day. It doesn't have to happen during the school day. So there are opportunities for us to send students out. And then in some cases, the student does that kind of on their own time, so to speak. Our hybrid experiences came about last year and really something that we embraced. So for example, you'll see the blood bank on there and you'll hear from the blood bank in my little video that I have to share, but we partnered with the blood bank of Delmarva. They actually ran Zoom sessions for a group of our students. And they actually did kind of a virtual mentoring, but throughout that, the students planned a community blood drive that happened in person. And the students had an opportunity to go and actually work. There were 2 dates for the community blood drive. The students could go and work on site. And so it was a hybrid experience. Some of it was Zoom and some of it was actually in person. The same applied for a dentist office that we worked with last year. They ran Zoom sessions with a group of students, provided the industry partnership, and each student, one at a time, had an opportunity to go and spend a day at the dentist office in person as a job shadow. So that has proved to be a really effective way for us to onboard partners that maybe cannot host students on site for an extended period of time, but are willing to support our students in this capacity. And then our virtual immersion experiences, as I mentioned, these are all examples of some that happened last year and some that we have lined up again for this year. Again, there are 50 hours, 6 touch points, and in some cases they happen during the school day. In some cases they're out of the school day. There's a lot of flexibility, but we actually had multiple physical therapy mentors that were virtual. And just as an example, I put pediatric PT up there. We have a lot of students that seem to be interested in the NICU. And we know that's an area that's difficult for students to go in person, especially now. But our pediatric physical therapist works with babies up to age 3 and spends a lot of time in the NICU. So she was able to virtually support the students that had an interest in NICU, but weren't necessarily able to go and see that in person. And she helped them develop project ideas and shared resource materials. And it was a fantastic experience. And she's already preparing to work with another group again this year. We had some students interested in music therapy, and we connected with a gentleman that was able to provide some online support with that. And he mentored a group. We had health coaching. We have a mentor that specializes in bioethics and has a lot of experience, many years of experience in not only bioethics, but emergency room work. And then we had a dermatology mentor, and I was on the call where she took her phone and she went through the office, and we did a little virtual field trip, and the students actually got to see the office. And every time she connected, the same thing happened with our optometrist. It was a virtual mentorship, but she was in the office and she could show the students using, taking the camera and going around the office, and then she could interact and answer their specific questions and provide resources. So we made it work, and it was phenomenal. And I think that it was really beneficial, even in a virtual setting. I have a little video that I'm going to share with you. Hopefully you're going to be able to see and hear. And so Nancy, if you can help me and just let me know if for some reason you don't hear.
Okay.
But just to set it up a little bit, I reached out to several of our students and to several of our partners, and I didn't provide a whole lot of parameters other than to say, can you tell us about your experience? What did you like? What did you learn? And so I'm going to let you hear from them.
Hello, my name is Colleen Kelly, and I am the head athletic trainer at Middletown High School. As the athletic trainer, I actually work for Premier Physical Therapy, but I am blessed to work full-time in the school with our students and our athletes. As part of the work-based learning, I have been a mentor to some of our students who are going through their senior capstone and wanting to know a little bit more about athletic training. Last year, during COVID and the pandemic, we offered some Zoom sessions where I met with students and we went over specific injuries and how to take care of them, and I gave them some resources to look into. As we progressed through the year last year, we were able to do some in-person learning as well. Fortunately, this year we are somewhat back to normal and all of my students are doing in-person learning, meaning they are coming in several days a week to shadow me in the athletic training room and also to work on the sidelines for all of our sporting events. They have been able to watch what we do, learn about the career, and even learn how to take care of some injuries. It's anywhere from learning how to tape, learning how to stretch, running on the field when we have injured athletes, or anything along those lines. So I'm blessed to have been able to mentor some of these students, and I think they have learned about the career, and some have even decided to study this in college. So whether it's virtual or in-person learning, I think that athletic training, being here in the school and not having to send the kids out to different sites, is a blessing and something that we will continue to do. And I look forward to working with many more students in the future.
Hi, my name is Tony Deborah. I'm a senior at Middletown High School. I'm part of the Allied Health Pathway. I did my placement at Premier Physical Therapy. My mentor was Jen Atwood and some of the other physical therapists inside the facility. So throughout the month of October, I was just watching them treat people of all ages, from really about, I want to say, 13 to the elderly, just treating them with their injuries. I would say just really what I've been asking them is just kind of how many years they've done in school, and then how do they help people, just seeing people with injuries and how they help treat them. One of the nice things I learned from being over there was just seeing the patient's growth overall. I talked with some of the patients. One of the patients had a hamstring injury, and just not being able to do certain movements a certain week later, and after doing exercises, stretches, and working on it from there, just the improvement in their leg. I plan on going to the University of Kentucky on a football scholarship. I plan on majoring in business, but one of the things I did for health was I played football, so I chose Premier just to learn more about my body, how I can take care of myself, prevent injuries. I have a few teammates who also torn their ACL, and they're also going to Premier Physical Therapy, which is popular in my area, and getting treated by people like my mentor Jen Atwood and some of the other physical therapists over there. Also, I like many things of being able to go over there. A lot of things with time flexibility, just time flexibility. Were able to let me come and do my hours whenever I had the chance to, going from school and be able to do my hours and then go right back to practice was definitely beneficial to me. Another thing I liked was just really seeing how friendly they all were with the patients. Some of the patients were real elderly. Some elderly people, they like to do a lot of things on their own because they don't like when people feel like they can't help them. And they always just, you can see how they're accustomed to each patient and helping each patient achieve all their needs at once.
Hi, my name is Kylie Myers and I'm a senior at Middletown High School. I'm in the Allied Health Pathway, and this summer I was able to mentor Nicole Fisher at Surgical Associates in Deborah. Part of my program was I got to go in and sit on live procedures and meet with different patients following Miss Nicole around the building. She is a physician's assistant, and part of her job is helping post-op different procedures and checking and tending to different wounds. So that's going to influence me in the future because I plan on going into nursing. So not only was I mentoring her, but I was able to see all of the different nurses in office and check out their daily routine.
Sure.
So that helped confirm that for my future, I want to continue nursing school and work in a hospital as I get older.
Hi, my name is Ashlyn Small, and I was in the Allied Health Pathway at Middletown High School. For my capstone project, I was placed with Dr. Mehta of their internal medicine pediatrics. Unfortunately, I was not able to go into the building and get a hands-on learning experience, but the knowledge that I gained virtually was definitely still valuable. Through email and Zoom communication, he was able to help me through the process of pulling my project together by just providing additional resources and some firsthand insight into the So my capstone project was titled Advocacy for Young Children with Anxiety. It surrounded the idea that most people target adults and children when discussing anxiety, and through research I found that there aren't many resources out there that discuss the signs and symptoms and treatments of anxiety, specifically in children ages 13 and younger. And the purpose of my project was to be one of those resources. Initially, I didn't like the idea of this project. As it was being introduced to us, it just kind of felt like it was busy work, it would take up a lot of time, and honestly that it would just be a lot of work. But as I began speaking with my mentor, doing my research and pulling my project together, I realized that it was something that could potentially be important to others, and it kind of got me excited for my future in pediatrics. I learned a lot from the research that I did, mainly in the differences in mental health disorders between children and adults. But I also learned a lot about myself and about what I want my future to look like. I realized that while my dreams of being in pediatrics have not changed, I now know that I want to continue to advocate for underrepresented groups within the pediatric world. I'm grateful to my mentor and my pathway advisors for the opportunity to do this because I definitely gained a lot of knowledge that I am ready to take with me to college. Thank you.
Hello, I am Tony Prado with the Blood Bank of Delmarva, and we service all 19 hospitals in the Delmarva Peninsula. And it takes 350 donors a day to do that, and it all starts right here in donor services, which is where our phlebotomists are based, and our volunteer donors come in to give blood, which means they're not financially compensated. They're doing this out of the goodness of their heart, and we thank them wholeheartedly. When the pandemic hit in March 2020, it was really tough because in order to collect the blood products we need, one of the things we do is go out to high schools and colleges. That accounts for a whopping 25% of the blood we collect daily. And when we couldn't do that anymore with the pandemic, we were left scrambling. And we got to give credit to the kids in the Appoquinimink School District, namely Appoquinimink High School and Middletown High School, worked with us through a capstone project, as it's called, to coordinate a blood drive off campus since we couldn't get to school. That was held at Middletown Fire Hall over the course of 2 days last March, and it was...
Hello,
So, sorry, that cut off there. I just have to say, I love our kids at Middletown High School and Appoquinimink High School, and our digital communication students created that video for me. So I'm just gonna give a shout out to the students. As you could hear from the testimonials that were offered there, you heard examples of virtual, hybrid, and in-person experiences. And you also heard that some students participate over the summer, while others, in the example of our athlete, he actually was able to go to his placement from 11:30 to 2, and then he was able to be back at school for his practice. So we really do try to work with the students and accommodate their schedules. We absolutely want to celebrate the fact that it seems to really have a positive impact on the students with their next steps. They often will comment on, before I did this, I didn't know XYZ, and because I did this, now I plan to. So we're really seeing the impact of the work-based learning experience and how it's helping to shape, not only build their network, but shape their goals and their future steps. One of the things that I would like to emphasize is using our in-district opportunities. So we have partnerships within our district with our athletic trainers, our school psychologists, our school nurses, our occupational therapists, our speech therapists, and our district nutrition staff, and all of them have hosted students in person and or virtually. We have a lot of resources internally, and everyone within the district seems very willing to help and support, and it really does give our students a great experience. So I would encourage anyone that is looking for industry partners for your students to start within. And you'll definitely find that within your districts, we've got some healthcare experts that are willing to share. We require a student evaluation at the end of their experience. Again, I'm just sharing this in case you wanted to see a template. We have a PDF that we could hand a paper to a partner to evaluate a student, but what we choose is a Google form. And so you can see from the screenshot that we literally have the rubric in a Google form. When a student has spent 50 hours on a placement, whether it's virtual, in person, or hybrid, their industry partner or mentor is emailed the Google form. They fill that out, and then we have a record of the student's participation and evaluation that we can then share with them as feedback. I know I'm talking fast because we're within it. We need to fall within the hour, and I'm doing my best here. So as far as some helpful tips, advisory board support is extremely important for us, and that, you know, the partnership breakfast and other community events that they support us with are extremely important. The alumni engagement I've already mentioned. Community outreach, we do spend some time with our chamber, our local chamber of commerce, and that has been a great support. They've provided speakers, they've provided assistance with our workforce readiness fair. We have some local hospitals that offer programs. So there's a Voyagers program. And so we're able to share those opportunities with our students and expand the work-based learning experiences across all grade levels. Virtual engagement, we utilize a platform called Nephros, and I'm going to share that with you in just a minute. And we also use Zello for a lot of our opportunity management, and I'll share that resource with you as well. You'll see a photo here of our students participating in the Rare Disease Day event, and I know that you all are familiar with that. But that's another example of an industry partnership experience for our students. And so we definitely want to encourage and promote, and as a work-based learning team, we encourage our students to take advantage of any CTSO opportunity where they get to network with professionals from that industry. I mentioned Zello. Zello is something that we use here within our district for, I'm sure you're familiar with student success plans and things of that nature, and there's different platforms for housing that. We utilize Zello for that. And then we also, there are career exploration tools there for the students. We use Zello for scheduling. So it's got multiple purposes within our district. But you'll see here that when I go into Zello, I can go in as an educator, and that would allow me to help students with career exploration or scheduling or tracking their classes or anything like that that I might need. But I can also go in as a work-based learning administrator. And what that allows me to do is maintain a database for our industry partners. So Zello houses companies, contacts, and links those together. So we can create spreadsheets. We have all of our business partners housed in one location. So across district, my work-based learning team, we can share this information if we need to reach out to someone for an opportunity. And then Zello also allows us to post opportunities. So for example, if the veterinary hospital was willing to host an internship, then we could post that opportunity in Zello, and our students can see that and apply there directly. So we're really in the process of building out our Zello platform so that, and we're trying to redirect our students there for opportunities. The platform's amazing. Our students are just kind of now getting to use it to learn the platform. So one of our goals for work-based learning this year is to put more opportunities in Zello and direct students there, because we know that this is going to help us to really manage as our network grows and as experiences grow. Oops, I went backwards. Nephros is something that we discovered right around the time that the pandemic happened and we went virtual. But Nephros has been a great resource for us. It is a platform that it's all virtual. They offer scheduled industry chats that we can join. We can also request class presentations so we can get virtual guest speakers. And the network is vast. There hasn't been anything I've looked for in Nephros that I haven't been able to find. We've invited Nephros speakers for lunch and learns, and we did a lot of virtual lunch and learns last year. And wonderful. We had amazing industry partners that connected with us through Nephros. They have a video library the students can access. So just by way of example, I had a student come to me yesterday and she was interested, she's a junior, interested in sports psychology. And I didn't have a whole lot of information right off the cuff, but I said, let's check Nephros and see what's there. And sure enough, there were some videos on sports psychology where they interviewed professionals. So that's where we'll start. And then of course, I'll continue to support her as she looks at immersion experiences. But that's just been a great tool for us. Our teachers use Nephros, and then we use Nephros as well when we're supporting the students with experiences. Some of the challenges that we have had, I think, are not going to be surprising. Last year, we had restricted access to locations to send students in person. And then what we also faced last year was schedule changes. I think we had 4 different schedules by January of last year for our school, because we were all virtual and then we were in cohorts. And so the schedule changed every time. And that created challenges for us just in terms of students connecting with mentors. So if students were trying to connect with mentors and they were going to meet on Wednesdays at 12 o'clock, that 2 weeks later, 4 weeks later, when the schedule changed, that maybe didn't work anymore. So those were some of the challenges that we worked through. And we know that transportation is always going to be a concern that we have with work-based learning. But we've found by offering virtual and hybrid experiences, that has kind of helped in cases where transportation was a barrier. Tracking the documentation as we have gone to scale, there's a lot. There are a lot of students, there's a lot of documentation. And so we're looking to streamline that. And we think that using Zello is going to really help us. We rely heavily on Google. We rely heavily on our Adobe sign process. But we think that Zello is going to be our answer for helping us to streamline. And then, of course, growing the network. That's just something we're going to continue to work on. But even with challenges, celebrations, and there is a lot to celebrate. So within our district, we have a tremendous support from our district leadership. We also have tremendous community support. So whether we're out, I live in this community where our schools are located. So if I'm at the supermarket or I'm at the baseball field, we're getting a lot of positive affirmation from the community members. And then when we go to business partners or we go to the Chamber of Commerce, we are getting a very positive response. So that's a lot to celebrate. Our Department of Education and our Office of Work-Based Learning, phenomenal. And so we know that that's a celebration. And again, that's a testament to the district leadership and the state leadership in helping us to grow work-based learning. We have great industry partners. Our team likes to say that people rarely tell us no, and that's a great thing. They just are willing to do what's right for kids and what's good for kids. And we're really, really amazed with how many people have wrapped around us in growing this. It's been wonderful. Alumni engagement. Our alumni, I have some mentors right now that are in their probably 23, 24, 25. They're graduates of our district. They already want to give back, and the students are really excited to have the alumni come back and work with them. And our students are having meaningful experiences, and they're finding success, as you could hear from our testimonials. So there is a lot to celebrate, and we focus on that rather than any of the challenges that we know we'll overcome. I provided some resources here for you. If you're interested in Nephros or Zello, our district website is there, as well as the Office of Work-Based Learning. And I think most importantly, our email is there. So I make myself available, and I think that Peg would as well. If you have any questions, if we can provide any additional information, any supporting documents, I'm happy to help and share. Feel free to reach out over email, and we'll work together. Thank you so much. I know that I pushed my time here and I don't want to keep you any later. I'll stay as long as anyone else wants to stay, but I certainly appreciate the opportunity to share with you today.
Oh, it was outstanding, Debbie, and very impressive. We're all jealous of what of how this is so organized, and it sounds like so supportive. What do the students get at the end of the 50 hours? Is this a course credit?
It is. Our students receive a credit on their transcript that says work-based learning practicum, and okay, they earn 1 credit for that. So our pathways in our district, the students complete a 4-credit pathway. So if they're in allied health or public and community health, they have 4 credits, and then we say this is their 5th pathway credit.
And then there was a question about the workforce readiness curriculum. if workplace behavior was included in there.
It is, the booklet is probably 20 pages or so. So each of those sections that I showed you really kind of dive in. It's very student friendly, but there are pages there on proper office etiquette. And it even goes into speaking loudly on the phone. It goes into wearing perfumes that are strong. I mean, it really covers a lot of very practical information that students would need to know in the workplace. And then, as I mentioned, when we do our workforce readiness fair and we have our panel, we often invite, industry professionals to share, and they typically have very good stories and very good examples of things that have happened in the workplace and kind of do's and don'ts. So it covers things like casual dress and professional dress. It covers etiquette in the workspace. There's a lot of detail provided there, but very student friendly.
And then lastly, if someone wants to put a question in the chat, Heather asked about a copy of the presentation. Yes, this is being recorded and it'll be archived on our website. I know that there were lots of people that were interested in the forms, the training agreement, and the student evaluation, and there may have been one more. Are those documents that we could post along with your recording, or are they downloadable from your website? I just wondered how widely we could share that.
I have them as fillable PDFs, and they are not currently accessible on our website, but I will gladly share them with you. And if you have a way to attach them, we could, or if there's a follow-up email and we could attach them, you are certainly welcome to do that.
Okay, that sounds great. Any other last questions for Debbie? Besides, yay, she was wonderful. And we appreciate Peg helping us make that connection. And let's see, what are the requirements for an internship to count as a workplace experience?
So our requirements pre-immersion is the workforce readiness training and those Delaware work-based learning standards, and then the documentation. And then during their immersion, they have to document that they've invested a minimum of 50 hours. And I will tell you that 50 hours was locally decided. That's not necessarily a state directive. That's a local requirement. And so it's 50 hours, and there has to be documented industry partnership. So if it's virtual, it's the minimum of 6 touch points. If it's in person, obviously, they're spending time on the work site with that person. It could be paid or unpaid. So that is certainly not part of the requirement, but it's 50 hours with an industry partner. And if it's virtual, it has to have the 6 touch points. That's for the work-based learning. Now, to receive their capstone credit, which is actually a separate credit, it's tied to other things that they do through advisory. But for their capstone, in addition to 50 hours with the industry partner, they have to demonstrate research, problem solving, and a presentation. So that's kind of tied to the capstone requirement.
Okay, Cindy's going to unmute herself and ask a question about the advisory board.
Mm-hmm.
I believe. Cindy.
Hi, Debbie. I had a question that, all right, you said that the healthcare advisory board was more of a flipped model, and that the healthcare programs were not the leaders, but rather partners with this board. How did this board ever come to be?
That's a good question. Our district has adopted kind of the flipped model process. So we have 5 advisory boards now with a 6th one in development. So our district team does kind of take the lead on starting to get a group organized and presenting our pathways and presenting our programs and presenting, what our needs are. And then we really kind of look to some of our community members and partners to take the leadership role there and establish as a group. And then in many cases there's been a small group that has taken the lead, and then they have organized as a board and then invited others from their profession to join. So our district does take the lead on kind of getting it started, if you will. And then we look to our community partners to build that board out.
Great, thank you.
Mm-hmm.
So Debbie, we just can't thank you and Peg enough. There was one compliment, I think, and I would agree that this could certainly be a model. I know you talked about scalability and getting it where you want it just on the district level, but that there's certainly great content here that could be used on the state level and certainly districts across our nation. So thank you so much. And we look forward to having you back one day and hearing even more about this.
Well, thank you. I certainly appreciate the opportunity. I love our healthcare programs and I'm super proud of our students and happy to share. So let me know if I can provide any additional details and I would love to come back and visit again.